Welcome! Today we're going to learn how to read an ECG in a simplified step-by-step manner. Let's start with the basics. First, ensure the ECG is properly labelled with the patient's information. Check for clear, readable tracings. This foundational step helps us avoid any mix-ups and ensures we have accurate data to analyse. Next, we determine the heart rate. Here's a quick and easy method. Count the number of large squares between two R waves and divide 300 by this number. This simple calculation gives you the heart rate in beats per minute. Now let's assess the rhythm. Look at the RR intervals. Are they regular or irregular? Also confirm that each QRS complex is preceded by a P wave. This helps us understand the overall rhythm of the heart, whether it's steady or erratic. Moving on to the P waves. Ensure that P waves are present and consistent. Each P wave should be followed by a QRS complex. This tells us that the atria are contracting properly before the ventricles. Next, we measure the PR interval. Measure from the beginning of the P wave to the beginning of the QRS complex. The normal range is 0.12 to 0.20 seconds, or 3-5 small squares. This interval indicates the time it takes for the electrical impulse to travel from the atria to the ventricles. Now let's evaluate the QRS complex. Measure its duration, which should be less than 0.12 seconds or less than 3 small squares. The QRS complex represents the depolarization of the ventricles and is crucial for diagnosing ventricular abnormalities. Check the ST segment next. Look for any elevation or depression relative to the baseline. Any significant deviation can indicate myocardial ischemia or infarction. This is a critical step for identifying acute cardiac events. Next, examine the T waves. Ensure they are upright in most leads. Look for any abnormalities such as inversion or peaking, which can indicate issues like electrolyte imbalances or ischemia. Finally, measure the QT interval. Measure from the beginning of the Q wave to the end of the T wave. It should be within normal limits, usually less than half the RR interval. An abnormal QT interval can indicate risks for arrhythmias. Here's a quick reference for common ECG findings. A normal ECG shows a regular rhythm with normal P waves, PR interval, and QRS complex. Atrial fibrillation shows an irregular rhythm with no distinct P waves. Myocardial infarction can present with ST segment elevation or depression. Ventricular tachycardia shows wide QRS complexes, often without P waves. To help remember these steps, use the mnemonic rapid QT, rate, assess rhythm, P waves, interval PR, duration QRS, and QT interval. This mnemonic can make it easier to recall each step when reading an ECG. Thank you for joining me in this simplified guide to reading an ECG. Remember, practice makes perfect. Keep using these steps and mnemonic to improve your proficiency. If you have any questions or need further clarification, feel free to ask. Happy ECG reading, and don't forget to like, share and subscribe to Med Madness for more helpful content. Leave your comments below.